I want to ask a question. You talk about the getting the family involved, which is very important, but the community in general contributes
Mhm,
in many ways to
mhm.
stress, substance abuse, et cetera. And Andrew, when we were doing some conversations, you shared some pretty alarming statistics around the rates of substance abuse in Iowa. Can you talk about that? And then like, friends, not just family members, but friends, coworkers, how do we support people by not creating a culture that promotes substance abuse?
Yeah, I think it's prevalent in Iowa more so than we realize. Iowa State University had an article, they were talking about addiction recently, and I hadn't heard about meth a lot. I mean, it still exists. We see it in treatment, but everybody's talking about opiates and, overdoses and fentanyl. Iowa is still number one in the country for meth. And to be honest, short of Wisconsin, everybody knows Wisconsin's got drinking issues. Iowa is number two in the country for binge drinking. And you put those together, and we lead the nation in the number of individuals per capita, transition age youth, 18 to 24-year-olds who has substance use disorder. So we're the worst. We're the best or the worst. We're the worst in the country as it relates to some of these issues. I wanted to touch on what you addressed a little bit, Susanna, the idea of community, right? And the communities that we exist. I sure wasn't comfortable sharing early in my professional career that I didn't drink. I was also invited to plenty of social situations where there was drinking. To be honest, I was sober through my collegiate experience, and college is hostile to sobriety. And one of the things that Iowa State has done, and Drake University is engaging in, is the development of a collegiate recovering community. And so I see some recovering community folks on the call today. There's a recovering community in Des Moines that's being established, and a safe place with resources for people who are pursuing recovery. It's a great evolution. It's an important service to have, and generally speaking, when I talk to young people in recovery, I say, hey, if you want to be successful, hang out with successful people. If you want to be sober, hang out with people that are sober or supportive of sobriety. And I think it's important to talk about it and surround ourselves with people that are supportive.
Yeah.
I would encourage employers who are on the line, if you're working at a company, to not promote a culture of drinking or other types of unhealthiness. I mean, it's so easy to say, we're going to give somebody a bottle of wine as a present. That used to happen at a company I worked at for years. That was the gift. Or, let's go get a drink. Or, oh my God, I need to get it. I mean, just the conversations people have around those types of things, tiny differences it can make in the workplace to just talk about wellness and respect people's boundaries. That's far cry from what you guys are dealing with every day, but I think it's an important cultural element.
Well, and let me just highlight what you just said. You've got Susanna DeBaca, president, publisher, is that your title? Business publications, um, asking the business community to think twice about the culture that's being created around drinking. I applaud you for saying that, and I hope it spurs conversations.
Mhm. I think the state is also looking at, and nationally, looking at, there is not a lot of substance use treatment facilities. There's not enough. And they're really nationally looking at how we can really bring mental health and substance use together. I mean, the state did that. That's what the state's working on right now, is bringing the Department of Human Services and the Iowa Department of Public Health together, because they should be together. We're one person. Your head's connected to your body. So, and they're looking at how we can, organizations can treat the whole person. They're bringing in these in the last few years, they're called Certified Community Behavioral Health Centers, CCBHCs, where that's a requirement, where you can't just treat mental health, and you can't just treat substance use. You have to, if you're going to be a CCBHC, which there are 14 now, I believe, in Iowa, you have to do both. You have to provide substance use treatment and mental health treatment. So slowly, we're getting there.